Yeah, so hello everyone. How are you? So yeah, we're in April and it's a cesarean month. So we're going to share something about cesarean section, and we're going to share the indications of Caesar or cesarean section. For a mother to have a cesarean section, what do they put in considerance? So we're going to first look at the definition, as we all know, some we don't know. So yeah, cesarean section, it is an operation or a surgery. It is done just for the well-being of the mother. We are saving. It is a practice. It is a practice done to save a mother and the baby, to make sure that they are all in a good condition. So we are saving them from the pregnancy and childbirth related complications. So yeah, we are going to the indications. So we all know that at times we do not, like some of these operations take us unaware, though with cesarean section we expect it, because they do brief you when you're doing your antenatal, because as you know, childbirth, it isn't automatic, that you're going to go normal, or that you may find yourself or like going for Caesar. So this is why they also tell us to generally, as you are preparing for childbirth, to prepare also for emergencies. So when we are looking at the indications, yes, we have this cesarean section. The elective part is where you plan for it, and you just know, I'm carrying my baby, and at the individual, I'm going to get a Caesar maybe at 36. No, not at 36. 36 is still early, but you can say at 38, at 37, something like that. Or you go consult your physician. But there is also this part which is emergency, and this emergency part is the thing that takes you outside. Maybe things are becoming complicated, so they are finding themselves in a position where they have to save the baby and they have to save the mother, so they find themselves taking on the emergency cesarean section. We're going to first look at the cesarean section elective, the things that mainly we consider for us to take the elective. Like, I plan for it. If I know that I have been always giving birth this way, like the first baby, the firstborn was for like a cesarean section, second likewise. So it there on the third time, I just prepare and go for Caesar, because this is a scar for, like, there are two scars. So I found myself going in for elective. I planned beforehand on my third born. I planned beforehand, knowing that I'm going to get an elective Caesar. So though these things are, of course, the indications differ. I can get a C-section at like at my firstborn or on my firstborn, but the reason was on the baby, maybe. And for the next time, I find myself giving birth normally, yeah, like going through the normal birth. But either way, I can plan for it if I have previous scars. So yeah, if I know that I have previous scar, I just opt for elective. Yeah, and then we have, if it is mainly like mothers, like according to your life, you may end up knowing what type of birth you would like to take on. So there is even this part, in the elective part, a mother can decide and say, no, I may want to get a C-section. Then they will ask for a reason, of course. And to some mothers, of course, they may have maternal medical problems, or they are like, yeah, according to the previous pregnancies, I am deciding this time that I should do a C-section. Maybe the last pregnancy was let me take it as obstetric like previous history, which is very bad. Like maybe when you went for normal, you had a prolonged labor, and then even after traveling all through the world, then you find yourself you're ending up with a Caesar. So a mother can decide and say, this pregnancy, though I know I may have chances of having a normal delivery, I'm deciding that I'm taking on a C-section. And yeah, with the mother's request, you can we are still saying that with the mother's request, you may say, this is my first baby, like I've taken long looking for this child, I cannot risk it. So I am deciding to take on cesarean section. So yeah, even this can be counted. So another thing, another point, or another reason, another indication why you would like to have, or why you would end up having a cesarean section. Remember, we are still on this elective Caesar where we just plan for it. So when we are pregnant, we tend to do scans, and when we do scan, when we go for scan, they tell us results a bit earlier. So you find yourself that your baby is presenting like his positions, maybe because like the position is not well, so we call it malpresentation. You find that it would be hard for you to give birth to a child who is sleeping transverse in the stomach. So you find yourself that from, like, it may be by 7 months, you're going to the scan, they're showing you the baby is transverse, the baby is not changing. By 8 months, you're clearly sure, by 8 and some weeks, you're surely sure, like you're sure that you're going to have a Caesar, because you can't push someone who has failed to change position. So yeah, that one can also be. And another, so we will say multiple pregnancy or twin pregnancy, though not all pregnant, like twin pregnant mothers undergo this. The main reason, it may be the twins are big, or maybe their positions, you know, the first baby may be in a good position and you can push that baby, but then the second one is lying in a funny way, and we cannot risk it to take you to the labor suite just to push one, and then what will happen to the other. So you may end up booking a cesarean section, elective of course. So we are also looking at times we get to understand, we get to know that we have contracted pelvises. It is like a pelvis, it is small, and you cannot, okay, it is small, yes, that is your way, and like that is the way you are. So there is no way they're going to say that you are going to adjust the bones, no. So you find yourself having this. In some cases it is an emergency, though in other cases it is elective, because if at all it is discussed early, or it is discovered early, because by 37 there is a pelvic assessment if you're going for your antenatal well, and then they will get to know that, oh, you will not be able to push this baby, so you plan for a Caesar. I told you that emergency just comes and you don't know, but then when it comes to elective, you got there knowing that I'm going for this kind of delivery. So you give birth to your baby. What really matters is that you're okay and your baby is fine. The rest can follow. But yeah, we still approach our mothers. So we're going to this emergency. We're going to emergency C-section, and we will find CPD. You know, with CPD, it is cephalopelvic disproportion, and it is more like big baby, small pelvis. So you find yourself, you want to push, but the baby is not coming down. Then you end up getting the scissor. So in many cases, or in some cases, it is not located early. So you find yourself going to do this. So we have also fetal distress. With fetal distress, the baby is tired. They are listening to the heart. They are trying to trace the heart, and the heart is irregular. Then the healthy personnel will be like, mother, we're sorry, but for the better being of your baby and for you, we would ask you to please opt for a cesarean section. So these things are expected. And also, if we are saying failed induction. With failed induction, we are having you're due to labor, like your days are due, or your time is due, and you're finding yourself you're not getting labor pains. So they put some medication on you to induce labor, but as time goes by, they are saying you're not responding like the way the way it should be. So you end up finding yourself that you're going to go for scissor, and we call it an emergency, because originally we just induced, knowing that we could at least help you start your labor and then progress naturally, or maybe you can progress on medication till when the baby is out, but then it has failed. So even this, it is called an emergency. We are having a big baby. So these big babies, we are counting from 4 upwards. This is a big baby. So 4 kilograms upwards, that's a big baby. So you're on a risk of going to get a cesarean section. Like, why is it emergency? Because to some mothers, they can push even 5 kilograms, but when it happens to meet someone, okay, and things are not progressing the way they should be, then you find yourself you're going to do what? We're going for scissor, for an emergency scissor. So we're still talking about obstructed labor. With obstructed labor, it's still the same, like the progress is not going well. We expect, because in normal delivery, we expect that the pelvis, the cervix will dilate well, and everything will be fine. The progress and the labor progress will be fine. But now we are finding that it isn't working the way we wanted it to. So you end up getting your cesarean section. So we have abruptio placenta. Abruptio placenta, it means your placenta has separated from the uterine walls, and then you're bleeding, because they come with bleeding. Alright, you may find yourself bleeding. With uterine rupture, it sometimes comes with delay or something else, but all the same, you're having a C-section. And okay, we're going to mention a few